Welcome to the deep dive. Ready for a journey through the world of your gut and liver?
We're going to explore everything from simple indigestion to more complex things like cirrhosis.
Yeah, it's kind of like a crash course on medical school stuff.
Exactly, but way more fun.
So we've got some fascinating medical lectures, right? They cover all sorts of gastrointestinal and hepatobiliary pathologies.
Oh, yeah, and we'll even touch on things like pediatric issues and eating disorders.
By the end of this deep dive, you're going to have a much better understanding of these conditions and what makes each one unique.
That's the goal.
So let's jump right in with something everyone's experienced.
Okay, sounds good.
Difficulty swallowing. Medically, it's known as dysphagia.
Right, dysphagia.
Yeah.
And it can be caused by a bunch of different issues. So to figure out what's going on, doctors use this technique called fluoroscopy.
Fluoroscopy?
Yeah, it's pretty amazing. They use x-rays, but it's like real-time video of your insides as you swallow.
Wow, that's like a tiny camera crew in your body.
Ah, yeah, kind of.
And there are different types of these fluoroscopy studies, right?
You got it. So there's an esophagram, which, focuses on the esophagus. Then there's an upper GI study, which looks at both the esophagus and the stomach.
I see.
And if your doctor is worried about food or liquid going down the wrong pipe into your lungs, they might do a modified barium swallow study.
Okay, so if you're struggling to swallow, your doctor might recommend one of these tests to pinpoint the problem. Now, what about achalasia?
Achalasia, it literally means failure to relax. It affects the muscle at the bottom of the esophagus, the one that controls food going into the stomach. In achalasia, this muscle doesn't relax right, so food backs up.
Oh, I see.
And on an x-ray, it creates this narrowing that looks just like a bird's beak. It's kind of classic.
Interesting. Okay, let's move on to something many of us have dealt with. GER.
Oh, yeah, GERD.
Yeah.
Or, gastroesophageal reflux disease. Basically, it's the fancy term for heartburn.
Heartburn, right.
It happens when stomach acid splashes up into the esophagus, which, irritates the lining and causes that burning feeling.
That's not fun.
Definitely not. It's often linked to stuff like what you eat, whether you smoke, and even those hiatal hernias where part of the stomach pushes up into your chest.
Right. So while occasional heartburn is normal, if you're popping antacids like candy, it's time to see your doctor.
Definitely. Frequent or really bad GERD can cause problems, like inflammation in your esophagus, or even Barrett's esophagus, which ups your risk of esophageal cancer.
That's scary. So what can you do about it?
Well, some lifestyle changes can help a lot, like avoiding trigger foods, quitting smoking if you do, and eating smaller meals. And of course, there are medications like those antacids, H2 blockers, and PPIs, which is short for proton pump inhibitors.
Right, and those help by reducing how much acid your stomach makes.
Exactly. Now let's talk about peptic ulcers.
Ulcers, I always thought they were from stress and spicy food.
Well, stress and food can play a part, but the main culprit is this bacteria called H. pylori.
A bacteria?
Yeah, it kind of weakens the lining of your stomach, making it vulnerable to damage from that acid.
Wow, so it's not just about what you eat.
Nope. And another big thing is overusing those NSAIDs, ibuprofen, aspirin.
Those everyday painkillers.
Yep, those too. So it's really important to use them carefully and only as directed.
Makes sense. So what happens if an ulcer is left untreated?
Not good things. It can bleed or even perforate, create a hole.
Oh, wow.
Yeah, and that can lead to serious infection. Early diagnosis is really key.
Definitely sounds like it. Okay, switching gears a bit, let's talk about celiac disease.
Celiac disease, it's an autoimmune thing triggered by gluten.
Right, gluten, that protein in wheat, barley, and rye.
Yeah, so for people with celiac, eating gluten triggers their immune system to attack their own small intestine.
It's not just a sensitivity, it's an actual attack. What kind of symptoms do people with celiac disease experience?
Oh, all sorts. You might get the classic, diarrhea, bloating, belly pain. But there's also fatigue, anemia, even skin rashes. There's one rash called dermatitis herpetiformis.
Dermatitis herpetiformis?
It's super itchy with blisters, not something you'd think of with digestion.
Not at all. So if you have ongoing gut problems, it's worth getting tested for celiac disease, even if you don't have the classic symptoms.
I agree. And the good news is, once you're diagnosed, managing celiac disease is pretty straightforward.
Just avoid gluten, right?
Yeah. A strict gluten-free diet allows the small intestine to heal.
Speaking of digestive issues, let's talk about the extremes. Constipation and diarrhea.
The two ends of the spectrum, right?
Exactly.
So constipation is basically, fewer than 3 bowel movements a week. With hard stools, diarrhea, loose, watery stools, multiple times a day.
And the causes are all over the place.
Yeah, constipation can be from not enough fiber, dehydration, not moving enough, some medications, even medical conditions.
And diarrhea.
Often it's from infections, or maybe you can't tolerate certain foods. Medications can do it too. And then there are digestive disorders like IBS or IBD.
IBS, irritable bowel syndrome.
Mm-hmm.
IBD, inflammatory bowel disease.
Right. And there's also C. diff diarrhea.
That one's caused by a bacteria, Clostridium difficile, right?
You got it. It's often linked to antibiotic use. And get this, a fecal transplant can be a treatment.
A fecal transplant.
Yeah, sounds weird, I know, but it's basically transferring stool from a healthy person to someone with C. diff. Helps restore the balance in the gut.
That's wild. Okay, on to diverticulitis. It affects the large intestine, right?
Right. To understand diverticulitis, we need to talk about diverticulosis, which is having little pouches in the colon wall. These pouches are really common, especially as you get older.
So having these pouches isn't necessarily a problem.
Not always. Lots of people with diverticulosis never have symptoms. But if those pouches get inflamed or infected, then it's diverticulitis.
Ah, okay.
Yeah, that can cause bad pain, usually in the lower left belly, fever, nausea, even changes in your bowel habits.
So what are the risk factors for developing diverticulitis?
Age is a big one. Also, a low-fiber diet. Not enough fiber can increase pressure in the colon, making those pouches more likely to form and get inflamed.
Makes sense. So eating plenty of fruits, vegetables, and whole grains is important.
It really is. Now let's move on to something that people often confuse.
What's that?
IBD, inflammatory bowel disease, and IBS, irritable bowel syndrome.
I see.
People mix them up a lot, but they're pretty different. IBD refers to those chronic inflammatory conditions of the gut, like Crohn's disease and ulcerative colitis. Those involve the immune system going haywire and attacking the gut lining.
So it's not just a little irritation, it's a full-blown attack.
Right. And with IBS, there's no visible damage to the digestive tract. It's more about how the gut functions.
So with IBS, it's more about symptoms like belly pain, cramping, bloating, and changes in bowel habits.
Exactly. We don't know exactly what causes IBS, but it probably involves things like how the gut moves, how sensitive it is, the gut microbiome, even stress and anxiety.
And it can be tricky to diagnose, since the symptoms of IBS can overlap with those of IBD.
You're right. That's why it's important to see a doctor if you're having persistent digestive problems. They can figure out what's going on and recommend the right treatment.
Okay, now let's switch gears to the little ones and talk about some common pediatric gastrointestinal problems.
Okay, kids are especially prone to digestive issues, and some of these require immediate attention.
Like intussusception. I remember learning about that. It's where part of the intestine folds into itself.
You got it. And it often comes with a pretty distinctive symptom. Red currant jelly stools, which means there's blood and mucus in the stool.
That sounds serious.
It is. Another one to watch out for is volvulus, where the intestine twists on itself. It can cut off blood supply, which is a surgical emergency.
Wow. What else is there?
There's also pyloric stenosis, where the opening between the stomach and small intestine thickens, causing forceful vomiting.
And Hirschsprung's disease, right?
Yeah, that's where a part of the colon doesn't have the proper nerve supply, so passing stool becomes a problem.
Wow. So many different issues that can affect kids' digestion.
It's true, and it just highlights the importance of getting medical help quickly if a child has any unusual digestive symptoms.
Now let's move on to the liver.
Ah, the liver. It's essential, like a real workhorse. It does over 500 vital functions. It's often compared to that myth of Prometheus, whose liver kept regenerating.
Right. The liver is known for its ability to regenerate.
Yeah, even after a significant damage, it can often regrow. But it's not invincible. If it's constantly damaged, like from hepatitis or alcohol abuse, you can get cirrhosis, and that's irreversible scarring.
So we really need to take good care of it.
Absolutely. So one of the liver's main jobs is to detoxify the body, filter out all those harmful substances from the blood.
It's like a filter for the blood.
Yeah, kind of like that. It also makes clotting factors, which are crucial for stopping bleeding. And it converts ammonia, that toxic waste product, into urea.
What else does it do?
It produces albumin, a protein that helps maintain fluid balance. Oh, and it makes bile, which is crucial for digesting fats.
It really does a lot.
Yeah.
What happens when the liver isn't working right?
Well, you can get a whole range of symptoms. One of the most obvious is jaundice, that yellowing of the skin and eyes.
Right. That's a clear sign something's wrong.
Yeah, it happens when there's too much bilirubin in the blood, which means the liver isn't processing it properly.
Okay, so how do doctors assess liver function?
They use liver function tests, or LFTs. Those are blood tests that measure levels of certain enzymes and proteins associated with liver function.
So they provide a snapshot of how the liver is doing.
Exactly. Some of the key LFTs are AST, ALT, bilirubin, and albumin.
Okay, so what do those tell us?
Well, AST and ALT are enzymes found in liver cells. When those levels are high, it could mean there's liver damage. Bilirubin, we talked about that already. High levels mean jaundice.
Right.
And albumin, if that's low, it can indicate liver damage or maybe malnutrition since the liver makes this protein.
I see.
And there's also the AST to ALT ratio that can be informative too.
What does that tell us?
Well, a high AST to ALT ratio often points to alcoholic liver disease.
Okay, so let's talk about alcoholic liver disease in more detail.
Sure, so as the name suggests, it's caused by drinking too much alcohol over time.
Makes sense.
The liver processes alcohol, but if it's overloaded, it can get damaged. There are 3 stages: fatty liver, alcoholic hepatitis, and cirrhosis.
3 stages. Okay, so what's fatty liver?
Fatty liver is the earliest stage. Basically, fat builds up in the liver. The good news is it's often reversible if you stop drinking.
So if you catch it early and stop drinking, the liver can recover.
In many cases, yeah. But if you keep drinking, you can develop alcoholic hepatitis, where the liver cells get inflamed and damaged.
And that's more serious.
Much more serious. It can even be life-threatening.
And then there's cirrhosis.
Yeah, cirrhosis is the final stage, and it's irreversible. That's when there's extensive scarring of the liver, and it can't function properly.
So limiting alcohol intake is crucial for liver health.
Absolutely. Now, let's move on to viral hepatitis. It's another major cause of liver disease.
Viral hepatitis, that's inflammation of the liver caused by a virus, right?
Exactly. There are different types, A, B, C, D, and E. Each one spreads differently and has varying chances of becoming chronic.
Which ones are most common?
Hep A and E are usually from contaminated food and water. Hep B and C are through blood and bodily fluids.
I see.
So things like sharing needles, unprotected sex, or exposure to infected blood are the main risks for those.
And some types can lead to long-term problems.
Yeah, especially D and C. They can become chronic and eventually progress to cirrhosis or even liver cancer. Getting tested is important if you're at risk.
Makes sense.
The good news is there are vaccines for Hep A and B, and they're super effective.
That's great. Okay, what about non-alcoholic fatty liver disease, or NAFLD?
NAFLD. It's like alcoholic fatty liver disease, but it happens in people who don't drink heavily. It's linked to obesity, insulin resistance, and metabolic syndrome.
So it's like having a fatty liver without the alcohol.
Yeah, basically. And it can progress to non-alcoholic steatohepatitis, or NAGE. That's when there's inflammation and damage to the liver cells.
And that can lead to cirrhosis as well.
Sadly, yes. It's a growing problem, especially in places where obesity and metabolic syndrome are common.
Now let's revisit cirrhosis. It's the end stage of all those liver diseases we've talked about, right?
It is. It's basically when there's so much scarring in the liver that it can't function properly anymore, and it can lead to all sorts of complications.
Like what?
Well, one is portal hypertension. That's increased pressure in the portal vein, which carries blood from the digestive organs to the liver.
So the blood flow gets backed up.
Exactly. And that can lead to esophageal varices, which are enlarged veins in the esophagus.
Those sound dangerous.
They are. They can bleed easily. Another problem is ascites, which is fluid buildup in the belly.
I've heard of that.
Yeah. And then there's hepatic encephalopathy. That's when the liver can't filter toxins properly, and they build up in the blood and affect the brain.
So it can lead to confusion and other mental changes.
Yeah, it can be really serious.
There's also a rare genetic disorder that affects the liver, Wilson's disease, right?
Yes, Wilson's disease. It causes copper to build up in the liver, the brain, and other organs.
Copper. Isn't that a good thing?
Copper is important, but too much is toxic. It can damage the liver and lead to cirrhosis, and it can also cause neurological problems.
So what are the treatment options for Wilson's disease?
Usually it's medications that bind to the copper and help remove it from the body. Early diagnosis and treatment are crucial to avoid long-term damage.
Makes sense. Now let's move on to the gallbladder and pancreas. They're both involved in digestion, right?
Yep. The gallbladder stores bile, which the liver produces. Bile helps break down fats, and the pancreas makes enzymes that help digest proteins, carbs, and fats.
So they're a team.
Exactly. Now let's talk about gallstones. They're pretty common.
Yeah, I've heard of those. Aren't they like little stones that form in the gallbladder?
You got it. They're usually made of cholesterol or bilirubin. And several things can make you more likely to get them, like being female, over 40, overweight. Oh, and a family history of gallstones?
There's that saying, right? The 6 Fs: female, 40, fat, fair, fertile, and family history.
Aha, that's the one.
So what happens if you have gallstones?
Lots of people don't have any symptoms, but when they do, it can be really painful.
What kind of pain?
It's called biliary colic. It's a sudden, sharp pain in the upper right belly, and it can radiate to your back or shoulder.
Ouch.
Yeah, it's often triggered by eating fatty foods because the gallbladder contracts to release bile, and a gallstone can block the duct.
What are the treatment options for gallstones?
Well, if you don't have symptoms, you might not need any treatment. But if you're in pain, the most common thing is to surgically remove the gallbladder. It's called a cholecystectomy.
And that's usually done laparoscopically now, right?
Yes, with small incisions and a quicker recovery.
That's good to know. Now let's talk about another condition related to gallstones: cholecystitis.
Right, cholecystitis. It's basically inflammation of the gallbladder,
Yeah.
usually because a gallstone is blocking the cystic duct. That's the tube connecting the gallbladder to the common bile duct.
So it's a complication of gallstones.
Yeah, exactly. It can cause severe pain in the upper right abdomen, along with fever, nausea, and vomiting.
So how is it diagnosed and treated?
Doctors usually use imaging studies like an ultrasound or a HAD scan. Remember, we talked about the HAD scan using a radioactive tracer. It can show if that cystic duct is blocked.
Right.
Treatment usually involves surgery to remove the gallbladder and antibiotics for the inflammation.
Okay. What about choledocholithiasis? That's another one we touched on earlier.
Right, choledocholithiasis. That's when you have gallstones in the common bile duct, the one that carries bile from the liver and gallbladder to the small intestine.
So a gallstone basically migrates from the gallbladder to the common bile duct.
Yep, that's it. And it can block bile flow, which causes all sorts of problems like jaundice, pain, and digestive issues.
And what's the most concerning complication?
One of the most serious ones is cholangitis. That's an infection of the bile duct. You see, when bile flow is blocked, bacteria can back up, and that leads to infection.
Yikes, that sounds bad.
It is. It's a medical emergency. You usually need antibiotics and a procedure to remove the blockage.
Now, switching gears to the pancreas, what is pancreatitis?
Pancreatitis is inflammation of the pancreas, the organ that makes digestive enzymes and hormones like insulin.
Right.
Gallstones and heavy alcohol use are the most common causes.
So those gallstones can cause trouble beyond the gallbladder.
Definitely. They can block the pancreatic duct, which carries those enzymes to the small intestine. And when that happens, the enzymes back up and cause inflammation.
So what are the symptoms of pancreatitis?
Usually severe pain in the upper abdomen, nausea, vomiting, and fever.
And how is it diagnosed and treated?
Blood tests, imaging studies, sometimes an endoscopic ultrasound.
And what about treatment?
Pain management, IV fluids, sometimes antibiotics, and maybe procedures to remove the gallstone.
Okay, let's move on to the appendix. What is that exactly?
It's a small pouch, kind of finger-shaped, attached to the colon. Some people think it might have helped digest cellulose a long time ago, but now it's pretty much useless.
So it's a vestigial organ,
Oh.
but it can cause problems, right? Like
Yeah.
appendicitis.
Yeah, appendicitis. It's when the appendix gets inflamed, and it's a common surgical emergency. Usually happens because of a blockage, which leads to infection.
And what are the symptoms?
Classic sign is pain that starts around the belly button and then moves to the lower right abdomen. You can also have fever, nausea, vomiting, loss of appetite.
So if you have those symptoms, you need to seek medical attention right away.
Exactly. If it's not treated quickly, the appendix can rupture, and that's a serious problem.
So how is appendicitis diagnosed?
Usually with a physical exam, blood tests, and imaging like a CT scan or ultrasound,
And treatment.
surgery to remove the appendix, an appendectomy.
Okay, last but not least, let's talk about eating disorders.
These are serious mental health conditions, involving disturbances in eating and body image.
Right, the most common ones are anorexia nervosa, bulimia nervosa, and binge eating disorder.
You got it.
So what exactly is anorexia nervosa?
It's characterized by an intense fear of gaining weight, distorted body image, and severe restriction of food intake.
So people with anorexia often see themselves as overweight even when they are very thin.
Exactly. They have a skewed perception of their bodies.
What about bulimia nervosa?
Bulimia is a cycle of binge eating followed by purging behaviors, like throwing up or misusing laxatives.
So it's overeating and then trying to compensate for it in unhealthy ways.
Right.
And finally, what's binge eating disorder?
Binge eating disorder involves those recurrent episodes of binge eating, but without the purging behaviors.
So they eat large amounts of food in a short period of time.
Yes, even when they aren't hungry, they often feel out of control during these episodes.
Eating disorders are very complex, and they can have serious consequences for both physical and mental health.
Absolutely. They require professional help, often a combination of therapy, medical monitoring, and nutritional counseling.
Now, let's step back and think about starvation. It can have devastating effects on the body.
Yes, starvation is a severe deficiency of calories and nutrients. In the short term, your body starts breaking down stored energy, and then it starts using muscle tissue.
Wow, so the body starts consuming itself.
In a way, yes. And if it goes on too long, it can lead to severe malnutrition.
Right, we talked about marasmus and kwashiorkor earlier.
Exactly. Those are serious conditions that can arise from starvation.
Can you remind us of the key differences between them?
Sure. Marasmus is a severe deficiency of all nutrients, leading to extreme wasting. Children with marasmus look emaciated. Kwashiorkor is primarily a protein deficiency. It often causes edema, a swollen belly, and changes in skin and hair.
So both are serious, but they have distinct features.
Exactly. And both can have lasting effects if not treated promptly. Yeah, it's a classic sign you see with cholecystitis.
So how is cholecystitis diagnosed?
Usually, doctors will do blood tests to look for inflammation and then imaging studies like an ultrasound.
To see the gallbladder.
Yep.
To see the gallbladder and check for those gallstones. And sometimes they'll use a HIDS scan.
Oh, right. That one uses a radioactive tracer.
Exactly, to track how the bile's flowing. It can show if that cystic duct is blocked.
Makes sense. So what about treatment?
Usually they'll remove the gallbladder surgically, that's a cholecystectomy, and they'll give you antibiotics for the inflammation.
And that surgery is mostly done laparoscopically these days, right?
Yeah, small incisions and faster recovery time.
Okay, good to know. Now, let's talk about something else related to gallstones. Gallstone pancreatitis.
Right, gallstone pancreatitis. It's not that common, but it can be pretty serious.
What happens?
Well, it's basically when a gallstone blocks the pancreatic duct.
That's the tube that carries digestive enzymes from the pancreas to the small intestine.
Exactly. So when it's blocked, those enzymes back up into the pancreas, and that causes inflammation and damage.
So the symptoms would be similar to pancreatitis from other causes, right?
Yeah, you're right. Severe abdominal pain, nausea, vomiting, fever.
And how do they diagnose it? Blood tests to measure those pancreatic enzymes, and then imaging studies like a CT scan. They might also use an endoscopic ultrasound to get a good look at the pancreatic duct.
What about treatment?
It usually starts with supportive care, like pain meds, fluids, maybe antibiotics.
To help with the symptoms and prevent infection.
Exactly, and sometimes they might need to do a procedure to remove that gallstone and unblock the duct.
Okay, let's shift back to the appendix for a bit. You mentioned earlier that it doesn't really have a function these days, but it can cause problems when it gets inflamed, right? That's appendicitis.
Appendicitis, yeah. It's a pretty common reason for emergency surgery.
And we know that the classic symptom is that pain that moves from the belly button to the lower right abdomen.
Right, right. But you can also have fever, nausea, vomiting. Sometimes you might lose your appetite or have some changes in your bowel habits.
Diarrhea or constipation.
Yeah, it's not just the pain that matters, it's that whole cluster of symptoms. And it's important to remember that the pain can be in different spots depending on where your appendix is.
That makes sense.
And if you don't get it treated quickly, that appendix can rupture.
And that's a really bad situation.
It is. It can lead to peritonitis, which is an infection of the whole abdominal cavity. That can be life-threatening. So if you think you might have appendicitis, go to the doctor right away. Don't wait.
How do they diagnose it?
They'll do a physical exam, blood tests, and imaging like a CT scan.
To see the appendix.
Yep. And then the treatment is surgery to remove it, an appendectomy.
Okay, good to know. Let's switch gears and talk about eating disorders. These are serious mental health conditions, and they can have a big impact on both physical and mental health.
You're absolutely right.
We've talked about the three main types: anorexia nervosa, bulimia nervosa, and binge eating disorder. Can you give us a bit more detail about the key differences between them?
Sure. So anorexia nervosa is all about restricting food intake, leading to a very low body weight. And there's also that intense fear of gaining weight and a distorted view of their body.
Right. It's not just about eating less. It's a mental health issue, too.
Exactly. People with anorexia often see themselves as overweight, even when they're dangerously thin.
That sounds really tough to deal with.
It is, and there are all sorts of serious complications that can happen. Malnutrition, heart problems, kidney problems, bone loss. It's really dangerous and needs medical attention.
What about bulimia nervosa? How is that different?
Bulimia is characterized by these cycles of binge eating, followed by purging, throwing up, using laxatives, exercising excessively. It's all about trying to prevent weight gain after overeating.
So they're stuck in this cycle of binging and purging. What kind of effects can that have on the body?
Oh, all sorts of problems: electrolyte imbalances, dehydration, dental problems from the stomach acid. It can even damage the esophagus.
Sounds really rough. And finally, we have binge eating disorder.
Right. Binge eating disorder is similar to bulimia in that there are these episodes of binge eating, but there's no purging afterward.
So they binge, but don't try to compensate for it.
Exactly. They eat a lot of food in a short period, even if they're not hungry, and they feel a lack of control during those binges. And then often they feel disgusted with themselves or guilty afterward.
That sounds really difficult emotionally.
It is. And it also increases the risk of obesity and all those health problems that come with it, like heart disease and diabetes.
It's important to remember that all eating disorders are serious mental health conditions, and they need professional treatment.
Absolutely. Now let's zoom out for a moment and think about malnutrition on a broader scale.
Early nutrition.
Yeah, it's when someone isn't getting enough nutrients. Can happen for lots of reasons: poverty, famine, eating disorders, even chronic illnesses.
Right. It's not just about not getting enough food. It's about not getting the right nutrients.
Exactly. And there are different types of malnutrition. The most common worldwide is protein energy malnutrition, or PE. Basically, not enough protein and calories. It can lead to wasting, which is thinness, and stunting, meaning being short for your age.
So it affects both weight and height.
Right. And there are two main forms of PM: marasmus and kwashiorkor. Remember those?
Yes, we talked about those earlier when we were discussing starvation.
So with marasmus, you have a severe deficiency of both protein and calories, leading to extreme thinness and loss of body fat. Kwashiorkor is mostly a protein deficiency, and it often causes edema, that swelling, usually in the legs and feet, a distended belly, and skin and hair changes.
So both are serious, but there are some key differences in how they present.
You got it. And both can have long-term consequences for physical and cognitive development if they're not treated. Then there's also micronutrient deficiencies.
What are those?
That's when you're not getting enough of specific vitamins and minerals, like vitamin A, iron, iodine, zinc.
So you might be getting enough calories overall, but you're still missing those key nutrients.
Exactly. It can happen because of a poor diet, problems with absorption, or increased needs, like during pregnancy.
And what are the consequences of those micronutrient deficiencies?
It depends on which nutrient is lacking, but it can lead to problems with growth and development, anemia, a weakened immune system, and a higher risk of infections and chronic diseases.
So it's important to make sure we're getting a balanced diet with all the nutrients we need.
Absolutely. Now, thinking back to portal hypertension, you mentioned that cirrhosis is the most common cause, but are there other things that can cause it?
Good question. Are there?
Yes, definitely. Blood clots in the portal vein or hepatic vein can cause it, and some parasitic infections like cystisomiasis. There's also something called non-cirrhotic portal hypertension, which is less common and doesn't involve scarring of the liver.
Interesting. And you mentioned earlier that portal hypertension can lead to ascites, that fluid buildup in the abdomen. How do they manage that?
It usually involves a combination of things. Changing your diet, like cutting down on salt, can help reduce fluid retention. They also use medications called diuretics, which help you pee out more fluid. And in some cases, they might have to do a procedure called paracentesis to drain the fluid directly from the abdomen.
And what about hepatic encephalopathy? That's the one where toxins build up in the blood and affect brain function, right?
That's right. It can be triggered by lots of things like infections, dehydration, constipation, even some medications.
So how do they manage it?
They focus on treating whatever triggered it and often use medications that lower ammonia levels in the blood.
Okay. We also talked about how cirrhosis increases the risk of liver cancer. What type of liver cancer is most common in people with cirrhosis?
That would be hepatocellular carcinoma, or HCC. People with cirrhosis usually need regular screenings for liver cancer.
To catch it early.
Exactly. Now, thinking back to gallstones, are there things people can do to lower their risk of getting them? You can't eliminate all risk factors, but some things can definitely help. Staying at a healthy weight, eating a balanced diet, getting regular exercise, and avoiding crash diets can all make a difference.
So those are good habits in general.
Absolutely. And if someone does develop gallstones, are there other treatment options besides surgery?
Good question. Are there?
Sometimes, if the stones are small and not causing any trouble, they might just watch and wait. There are medications that can dissolve gallstones, but they can take a while and they don't always work.
What else?
There's lithotripsy, which uses shock waves to break up the stones. But surgery is still the most effective treatment if you're having symptoms.
Makes sense. We've talked a lot about conditions that affect the gallbladder. What about the pancreas? Are there other things besides pancreatitis that can cause problems?
Oh, definitely. Pancreatic cancer is a big one. It's often diagnosed late, unfortunately.
And the symptoms are often vague.
Yes, things like belly pain, weight loss, jaundice, back pain. It's usually treated with a combination of surgery, chemo, and radiation.
Okay. What about pancreatic cysts? Are those always a concern?
Pancreatic cysts are fluid-filled sacs that can form in the pancreas. Most of them are benign, but some can be precancerous or cancerous, so sometimes they need monitoring or treatment.
And you mentioned pancreatic insufficiency earlier. What's that?
Pancreatic insufficiency is when the pancreas doesn't make enough digestive enzymes. That can lead to problems digesting food and absorbing nutrients.
So you might experience diarrhea, weight loss, that kind of thing.
Exactly. Usually it's treated with enzyme supplements.
Makes sense. Okay, back to the liver. We've talked about cirrhosis, but what are some other things that can damage the liver?
There are a lot of things, actually. Certain medications, like too much acetaminophen, can be a problem. Exposure to toxins, some herbal remedies, autoimmune diseases, and some genetic disorders.
Like hemochromatosis, right?
Yes, hemochromatosis. That's the one where iron builds up in the body.
And that can damage the liver.
It can. It can also cause problems with your heart, pancreas, joints, and skin. They treat it by removing blood from the body regularly to lower the iron levels.
Interesting. So are there things people can do to keep their liver healthy?
Definitely. Staying at a healthy weight, limiting alcohol, getting vaccinated against hepatitis A and B, being careful with medications and supplements, and avoiding exposure to toxins are all important.
Good advice. And it's good to remember that the liver can regenerate, so even if there's been some damage, healthy habits can help it recover.
I agree. Now, let's talk about the gut microbiome. It's been getting a lot of attention lately.
Yeah, the gut microbiome. What exactly is it?
It's basically all the bacteria and other microorganisms that live in our gut, trillions of them, and they're incredibly important for our health.
I've heard that. What do they do?
They help us digest food, produce some vitamins, influence our immune system, and even affect our mood and behavior.
So they're much more than just little helpers with digestion.
Right. They're crucial for our overall well-being.
What are some things that can mess up the balance of the gut microbiome?
Oh, lots of things. Diet, medications like antibiotics, stress, even how you were born.
Well, you're born.
Yeah, babies born vaginally have different bacteria than those born by C-section.
That's fascinating. So what happens if that gut microbiome gets out of balance?
It's called dysbiosis, and it's been linked to all sorts of problems, from digestive disorders to obesity, autoimmune diseases, even mental health issues like anxiety and depression.
Wow. So what can we do to help our gut microbiome?
Eating a diverse diet with lots of fiber, prebiotics, and probiotics is key. Prebiotics are like food for the good bacteria, and probiotics are those live bacteria that you find in foods like yogurt and sauerkraut.
Okay.
And of course, limiting processed foods, sugar, and unhealthy fats is important.
And what about medications?
Antibiotics are sometimes necessary, but they can really disrupt the gut microbiome. Talk to your doctor about ways to minimize the impact.
Makes sense. Anything else?
Managing stress can also help. Things like yoga, meditation, getting out in nature, and getting enough sleep is important too. And if you're having digestive issues, definitely talk to your doctor. They can help figure out what's going on and recommend the best treatment for you.
Okay, so now let's think about the liver's regenerative powers again. We've talked about how it can regenerate even after being damaged.
Right, but it's not invincible. If it's constantly being damaged, like from hepatitis or too much alcohol, it can lead to cirrhosis, and that's irreversible.
So even though it can regenerate, we still have to protect it.
Exactly. Preventing further damage is crucial.
What can people do to protect their liver and prevent liver disease from getting worse?
The most important thing is to manage any existing liver conditions. Work with your doctor, follow their treatment plan, whether that's medications, lifestyle changes, or regular monitoring. If you have hepatitis B or C, make sure you're getting treatment for that to stop further damage.
Makes sense. What about lifestyle changes?
Lots of things can help. Maintaining a healthy weight is important since being overweight puts extra stress on the liver. Eating a healthy diet with plenty of fruits, vegetables, and whole grains is also helpful. And limiting processed foods, sugary drinks, and unhealthy fats.
And what about alcohol?
Limiting alcohol or avoiding it altogether is one of the best things you can do for your liver.
Okay, that makes sense. What about medications? I know we're often warned to be careful with medications, but how can they affect the liver?
Well, the liver has to process all those medications we take, so if you take too much of certain drugs, even over-the-counter ones like acetaminophen, it can damage your liver.
So always follow the directions and don't take more than you're supposed to.
Absolutely. And what about natural remedies and supplements?
I've heard that some of those can be hard on the liver.
Yes, definitely. Some of them can be harmful, so always talk to your doctor before taking any new supplements, especially if you already have a liver condition.
So it's all about being proactive and making healthy choices.
Exactly. And remember, the liver is often called a silent organ. It might not give you any warning signs in the early stages of disease.
That's scary. So regular checkups and screenings are really important.
They are. Catching liver problems early can make a huge difference. Okay, let's talk about a condition that affects both the liver and the digestive system.
Which one is that?
Biliary atresia?
Biliary atresia? I haven't heard of that one.
It's rare, but it's a serious problem that affects infants. It's a blockage or absence of the bile duct.
Those are the tubes that carry bile from the liver to the small intestine, right?
Yep. And without those ducts, bile can't flow properly and it starts to back up in the liver, which can cause damage.
That sounds really serious. What are the signs of biliary atresia?
The main one is jaundice, that yellowing of the skin and eyes. Babies might also have dark urine, pale stools, and an enlarged liver.
What are the treatment options?
Early diagnosis and treatment are key. The first step is usually a surgery called the Kasai procedure, which tries to create a new pathway for the bile to drain. If that doesn't work, a liver transplant might be needed.
Biliary atresia sounds really challenging for families to go through.
It is. Early diagnosis, specialized care, and support are crucial. Okay, let's go back to the liver's role in digestion for a bit.
Sounds good. So how does the liver help us digest food?
The liver's main contribution to digestion is through its production of bile. Remember, bile helps break down fats in the small intestine.
Right, we talked about that earlier.
The liver is like a bile factory. The liver cells make the bile and then it's stored in the gallbladder until we need it. When we eat something fatty, the gallbladder releases that bile into the small intestine.
And why is bile so important for digesting fats?
It acts as an emulsifier. It breaks those big fat globules into smaller droplets so the digestive enzymes can get to them more easily. It's kind of like soap breaking down grease in a pan, makes it much easier to clean.
That's a good analogy. So if the bile duct gets blocked, that can really mess things up.
Definitely. We've already talked about how gallstones can block the duct, but there are other things that can cause blockages too, like tumors, inflammation, strictures, even pancreatic cancer.
So bile flow is really important. What happens if it's blocked?
Well, like we said, bile can back up and cause jaundice. It can also lead to problems with fat digestion. You might not be able to absorb those important fat-soluble vitamins.
Right, and we also talked about how it can affect vitamin K absorption, which is important for blood clotting. And that brings us back to the connection between the liver and blood clotting.
This is such a fascinating connection. The liver plays a central role in blood clotting. Remember that cascade of events we discussed?
The clotting cascade.
It involves all those clotting factors, and the liver makes most of them. So if the liver is damaged, it can really mess with the body's ability to clot properly.
And that's where vitamin K is important, right?
Exactly. Vitamin K is essential for activating some of those key clotting factors. Without enough vitamin K, they can't do their job. And remember, problems with bile flow can affect how well you absorb vitamin K.
It all comes full circle.
It does. It really highlights how interconnected these systems are. Now let's move on to another group of conditions.
Okay, what are we talking about now?
Vasculitis.
Vasculitis, what's that?
It's a group of disorders where the blood vessels get inflamed.
Sounds painful.
It can be. The inflammation can damage the vessel walls, narrow them, block them, or even weaken them.
What causes vasculitis?
For a lot of types, we don't know the exact cause, but we think it might be an autoimmune thing where the body attacks its own blood vessels. Sometimes it's triggered by infections, medications, or toxins.
So what kinds of symptoms do people with vasculitis have?
It really depends on which blood vessels are affected and how bad the inflammation is. Some general symptoms are fever, fatigue, weight loss, and muscle and joint aches.
Okay.
But there can also be more specific symptoms depending on where the problem is. Headaches, vision problems, skin rashes, numbness or tingling in the hands and feet, even belly pain.
So it can really affect any part of the body.
That's right. Any organ system.
How do they diagnose and treat it?
They'll do a physical exam, blood tests, imaging studies. Sometimes they'll take a biopsy of the affected blood vessel. Treatment depends on the specific type and how severe it is, but they often use medications to suppress the immune system.
Like steroids.
Yeah, corticosteroids and other immunosuppressants. It's a complex group of conditions, and early diagnosis and treatment are really important.
Okay, now let's talk about short bowel syndrome.
Short bowel syndrome, or SBS, happens when you're missing a big chunk of your small intestine.
Missing. Why would someone be missing part of their small intestine?
Could be from a birth defect, or maybe they had to have part of it removed because of Crohn's disease, an injury, or cancer.
So what happens when you're missing part of your small intestine?
Well, the small intestine is where most of the digestion and absorption happens, so if a big part is missing, you might have problems absorbing nutrients and fluids.
Makes sense. So what are the symptoms?
Diarrhea, malnutrition, dehydration.
And how is it treated?
They try to manage the symptoms and improve nutrient absorption. So often that means dietary changes like eating smaller, more frequent meals and avoiding foods high in fiber or fat.
What about medications?
Yeah, they might use meds to slow down the gut, reduce diarrhea, or supplement vitamins and minerals. Sometimes they might even need to give nutrients directly into the bloodstream.
Intravenously.
Yep, it can be a tough condition to live with, but with the right management, people with SBS can often live pretty normal lives.
Okay, let's talk about eosinophilic esophagitis, or EOE. What's that?
EOE is a chronic allergic condition that affects the esophagus. You get a buildup of these white blood cells called eosinophils in the lining of the esophagus.
And that causes inflammation.
Yeah, and then inflammation can make it hard to swallow, and sometimes food can get stuck.
What causes it?
We don't know for sure, but we think it's an allergic reaction to certain foods or environmental things.
So what are the symptoms?
Trouble swallowing, food getting stuck, heartburn, chest pain, nausea, vomiting. In kids, it can even lead to poor growth because they're not getting enough nutrients.
How do they diagnose and treat it?
They usually do an endoscopy to look at the esophagus and take biopsies. Treatment often involves cutting out common food allergens or following a special diet.
To reduce the inflammation.
Exactly. They might also use medications like PPIs or corticosteroids.
Okay. Now how about gastroparesis?
Gastroparesis is when the stomach muscles don't work properly, so the stomach doesn't empty as quickly as it should.
So the food just sits there.
Yeah, and that can cause nausea, vomiting, bloating, belly pain. People with gastroparesis often feel full quickly, even after eating just a little bit.
So what causes it?
The most common cause is diabetes, but other things can cause it too. Viral infections, certain medications, surgeries that involve the stomach or the vagus nerve.
And the vagus nerve helps control digestion, right?
Exactly. And sometimes they can't figure out the cause. That's called idiopathic gastroparesis.
So how do they diagnose and treat gastroparesis?
They usually do a gastric emptying study, which measures how quickly food empties from the stomach. Treatment is all about managing symptoms and helping the stomach empty better.
So dietary changes again.
Yeah, eating smaller, more frequent meals, avoiding high fiber and high fat foods, staying well hydrated. They might also use medications to help the stomach empty faster.
Okay. Now let's move on to gastrointestinal stromal tumors, or GISTs.
GISTs are rare tumors that can grow anywhere in the digestive tract, but they're usually found in the stomach or small intestine.
And what causes them?
Most GISTs are caused by gene mutations, usually in the KIT gene or the PDGFRA gene. These mutations can lead to uncontrolled cell growth and tumor formation.
So they're basically cancerous tumors.
Yes, that's right.
What are the symptoms of GISTs?
It depends on the size and location, but they can include belly pain, nausea, vomiting, bleeding, a feeling of fullness. Sometimes they're found by chance when someone's having an imaging test or surgery for something else.
So how are they treated?
Treatment usually involves surgery to remove the tumor, if possible. They also use targeted therapy medications that block the signals that make the tumor grow.
Okay, now let's talk about diverticular disease. We've mentioned diverticulosis and diverticulitis earlier.
Right, diverticular disease is the umbrella term. Diverticulosis is having those pouches, the diverticula, in the wall of the digestive tract. Diverticulitis is when those pouches get inflamed or infected.
Right, those pouches are usually in the colon. What are the symptoms of diverticulosis?
A lot of people don't have any symptoms, but some might have belly pain, bloating, constipation, or diarrhea.
And we talked earlier about how diverticulitis causes those more serious symptoms like pain in the lower left abdomen, fever, nausea, changes in bowel habits.
Exactly. Diverticulitis can also lead to complications, like those abscesses, perforations, and blockages.
What are some risk factors for diverticular disease?
Age is a big one, as is a low-fiber diet. Not moving enough, obesity, smoking, and some medications can also increase the risk.
So a healthy lifestyle can help lower the risk.
Absolutely. Eating lots of fiber and getting regular exercise are especially important. And if you do have diverticulosis, it's important to manage it carefully so you don't develop diverticulitis.
Makes sense. Okay, let's talk about hemorrhoids.
Hemorrhoids, those are swollen veins in the rectum and anus. Super common. Almost everyone gets them at some point.
Yeah, I've heard that. So what causes them?
It's all about increased pressure in the veins down there. Straining during bowel movements, constipation, pregnancy, obesity, even sitting for too long can contribute to it.
So what are the symptoms?
Usually rectal bleeding, bright red blood on the toilet paper. You might also have pain, itching, and a feeling of fullness or pressure.
Not fun.
Definitely not. So what can you do about them?
That's what I was going to ask.
Well, it depends how bad they are. For mild cases, over-the-counter creams and ointments can help. Warm baths, increasing fiber intake.
And if those don't work?
If they're more severe, they might have to do a procedure, like rubber band ligation, sclerotherapy, or surgery.
Okay, and finally, let's talk about ulcerative colitis. We discussed it earlier as one of the main types of inflammatory bowel disease, or IBD.
Right, ulcerative colitis. Chronic inflammation and ulcers in the lining of the colon. And unlike Crohn's disease, which can affect any part of the digestive tract, ulcerative colitis is only in the colon.
Right, and usually it starts in the rectum and spreads upward.
You got it. We talked about how bloody diarrhea is a hallmark symptom.
Right. But what other symptoms might someone experience?
They might also have abdominal cramping, urgency, frequent bowel movements, and tenesmus.
So that's best.
That's that feeling like you haven't completely emptied your bowels even after going to the bathroom.
That doesn't sound pleasant.
It's not. And remember, ulcerative colitis can lead to some pretty serious complications.
Right, we talked about those earlier. Severe bleeding, toxic megacolon, and even an increased risk of colon cancer.
Exactly. So if you have symptoms like bloody diarrhea, see a doctor right away. Early diagnosis and treatment are key. It is. And remember, it can cause all sorts of complications. Severe bleeding, toxic megacolon, even an increased risk of colon cancer.
So if you have any of those symptoms, it's really important to see a doctor and get checked out.
Absolutely. Early diagnosis and treatment can make a huge difference. Now, I'm curious about bile. It's always seemed a bit mysterious to me.
Bile, yeah. It's essential for digestion, but not a lot of people understand what it does.
Right. So the liver produces bile and it's stored in the gallbladder. When we eat, the gallbladder releases bile into the small intestine and it helps break down fats.
So it's like our body's detergent for fats.
Exactly.
Yeah.
It breaks down those large fat molecules into smaller droplets so that the digestive enzymes can do their job more effectively. Imagine trying to clean a greasy pan with just water. It's much easier if you use soap to break down the grease first. It's the same idea.
It's a good analogy. So what happens if the bile duct gets blocked?
Well, it can lead to a lot of problems. We talked about how gallstones can block the duct, leading to those conditions like cholecystitis and pancreatitis.
Right. But other things can block the bile duct too, right?
Yes, tumors, inflammation, and strictures, which are basically narrowings of the duct. Pancreatic cancer can also block the bile duct. And some medications or even rare genetic disorders can affect how bile is produced or transported.
So no matter what the cause is, blocked bile flow is a big problem.
Definitely. It can lead to jaundice because the bilirubin backs up in the bloodstream. And it can also mess with fat digestion, which can cause nutrient deficiencies.
And we discussed how blocked bile flow can affect vitamin K absorption, which is crucial for blood clotting. So there's that connection to the liver's role in blood clotting.
Exactly. The liver plays a major role in coagulation, the process of blood clotting. It makes most of those clotting factors that are involved in that complex cascade of events.
The clotting cascade, that's one with all the different proteins working together to stop bleeding, right?
Yeah. You got it. And if the liver isn't working properly, it can really throw off the body's ability to clot blood effectively.
And that's where vitamin K comes in. It's essential for activating some of those clotting factors.
Exactly. Without enough vitamin K, those clotting factors can't do their job. And if there's a problem with bile flow, you might not be absorbing enough vitamin K.
It's all connected. So problem in one area can really snowball and affect other systems in the body.
It really highlights the complexity of the human body and how everything works together.
Well, we've covered a lot of ground today, haven't we? From common digestive discomforts to some pretty complex medical conditions, we've really explored the inner workings of the digestive system and the liver.
It's been a fascinating journey for sure. We've talked about the intricacies of digestion, the liver's amazing ability to regenerate, and the importance of a healthy gut microbiome.
We've delved into inflammatory bowel diseases, learned about how liver function tests work, and seen the impact of malnutrition.
And throughout our discussion, we've seen how interconnected all these systems are. A problem in one area can have consequences in other parts of the body.
So taking care of our digestive and liver health is truly vital for our overall well-being.
Couldn't agree more.
It's been a pleasure having you as our expert today.
Thanks for having me. I always enjoy talking about these topics.
And to our listeners, thank you for joining us on this deep dive into the digestive system and liver. We hope you've learned something new and valuable today.
We hope so too.
And remember, if you're experiencing any digestive or liver-related issues, please don't hesitate to reach out to your healthcare provider. Early detection and treatment are so important. Stay curious, stay informed, and take good care of yourselves.